COVID changed so much about the way we live, I think, and the way we understand public health as a collective society.
The COVID-19 pandemic brought attention to public health incidents, including how diseases spread. But for many of us, the mental impacts still remain.
As a whole culture, we have PTSD from COVID.
Dr. Donald Milton is a respiratory specialist with the University of Maryland. He says when illnesses impact a lot of people, it can draw up a lot of attention.
Wakes people up and attracts interest, and there's money to be made if you can get eyeballs on your blog or Twitter post.
Back-to-back outbreaks of hantavirus and Ebola have dominated health headlines for months now.
The hantavirus and Ebola, we definitely need to be prepared and responding, but those are more unusual situations, very interesting and tragic, of course, but less general risk to the general public.
They're novel and they have high fatality rates. And so they attract a lot of attention.
While these diseases can be deadly, the risk of them spreading in the U.S. or even becoming another pandemic are low. But online chatter can cause pandemic panic.
A very important point is that the viruses are not actually spreading that panic. It's the behavior on social media.
This is why health officials, including Dr. Lori Furlano, the state epidemiologist for Virginia, say it's important to recognize where information is coming from.
We've learned a lot about, since the pandemic, is where people can get information. The internet, I think we have access to all kinds of sources of information, some of which are reliable and some sources are not reliable.
However, the reach of the internet does help to get information out.
Social media is a valuable tool. However, it has such a broad reach and isn't necessarily governed to the extent that we need it to be.
This is why health officials suggest going to verified sources.
I go to sources that I have vetted and can trust. I'm again biased, but I always like to think that your state and local health departments are great starting places for information, and other professional associations of clinicians.
Health officials say they are always willing to talk with folks to help ease fears.
We are here to answer the questions and here to explain things that need explaining.
Now, public health continues to be an ongoing battle. While diseases like Ebola and hantavirus aren't posing dangers to everyday Americans, medical personnel throughout the nation are staying vigilant to keep folks safe. Reporting here in studio, Nick Noliff, WFXR News.